Hello, everyone. My name is Cheyenne Mercer, and this is my colleague, Kevin Gilbert. We are happy to be presenting at this year's Diversity in Medicine Conference and talking about our work to increase diversity in healthcare and address health inequities through the creation of a community college pathway. Although African American, Hispanic, Latinx, and Native American communities make up 1/4 of the US population, only 14% make up our physician workforce. The percent of underrepresented and minoritized medical school graduates has only increased 5% since 1978, with other health professions performing similarly. Strategies aimed at diversifying health professions have focused on high school and college juniors and seniors. The COVID pandemic has expanded and highlighted these disparities and has placed pressure on minority physicians to handle the consequences. An overwhelming majority of community college students come from minoritized and low-income backgrounds. Recognizing this diversity and potential, the University of California, San Diego School of Medicine developed the UniversityLink Medical Science Program and California Medicine Scholars Program to better support diverse student populations interested in pursuing health science careers. ULMSP is designed to increase the recruitment, retention, and success of underrepresented and disadvantaged groups in health professions. It targets community college students from San Diego and Imperial County colleges who are from academic, economic, and socially disadvantaged backgrounds and are interested in pursuing healthcare professions. Students participate in a 4-week summer residential program in the summer before transferring to UCSD, followed by a longitudinal curriculum once they graduate from the program. The goals of the program are to create learning communities, provide access to diverse mentors and role models, foster career choice validation through out-of-class experience. And these goals are met by ULMSP's model, which contains 5 components: professional and academic skills, mentoring, networking, learning about UCSD campus culture, and wellness. And now I will pass off the mic to Kevin.
Perfect. Thank you, Cheyenne. Now, diving into ULMSP's outcomes from 2001 to 2015, we have had 165 students. All of our students come from either economic, educational, or environmentally disadvantaged backgrounds. More than half of our students are first-generation college students, with roughly 41% of our students having identified as Hispanic or Latinx, and with the next largest represented group being white, non-Hispanic, and Asian. Now, we recognize an area of improvement in our program is increasing the representation of our Black and African-American students, and especially our Black males. Since we recruit in the San Diego and Imperial County, 83% of our students transfer to UCSD, but 98% of our students have transferred to a 4-year university in California. Now, we collect both quantitative and qualitative data, with most of the qualitative data showing praise for the program's elements. Quantitatively, of our 165 students, 89% have obtained a bachelor's degree, with over 90% of those earning that degree in a biomedical science. The main statistic that reflects our success is roughly 68% of our students have enrolled in a professional or graduate school. Now, ULMSP's 15-year local success made us aware of the need for greater impact throughout the state. And this awareness led to coalitions being formed, which progressed to advocacy work, and ultimately the passing of legislations and the creation of California Medicine Scholars Program, which aims to provide a system-wide community college pathway that taps into the diversity of the California community college system as a means to support and increase the numbers of underrepresented minority physicians. Now, California Medicine was brought to fruition by Senator Melissa Hurtado, and Senator Hurtado saw the need to improve our healthcare workforce through community college pipelines and championed Senate Bill 40, otherwise known as SB 40. SB 40 provides $11.5 million over the course of 3 years that will be distributed through our regional hubs. These hubs will be located in strategic locations throughout California, but one will be guaranteed in the Central Valley, which has historically been a place of need. Each hub will consist of a range of community colleges, a handful of 4 universities, a medical school, and a few community partners in which our students can give back to their local communities. However, prior to being approved for state funding, the California Medicine Coalition went forward with a pilot to gain early data that will inform and influence the future hubs. And this pilot program is taking place in San Diego and targets the Region 10 community colleges. Currently, we're in the early stages of recruiting and creating the curriculum with a fantastic team of UCSD undergrads and medical students, most of whom were transfer students themselves. Ultimately, we all believe that providing systemic support across all levels of education will develop a more diverse pool of medical school applicants and doctors. In conclusion, our ULMSP outcomes have demonstrated that by providing a program that reduces the academic, social, and career barriers, we can improve the likelihood of these hidden gems in completing their undergraduate degree and gaining enrollment into professional school. Now, our vision is that California medicine will produce similar outcomes at a larger scale. So thank you all for listening. Our contact information is on the next slide, and we would love to answer any questions.